seeing Drew Brees, for example, quarterback from the New Orleans Saints, come back and have such a great career after a devastating shoulder injury was probably one of the proudest moments I've had.
Orthopedic surgeon Dr. James Andrews is one of the most important men in American sport. The monetary value of his patients' post-surgery playing careers can be calculated in the billions of dollars, and the number of trophy and title successes he's contributed to is countless. In 2010, Drew Brees led the New Orleans Saints to Super Bowl glory, 5 years after a serious shoulder injury.
It was a very difficult surgery because he dove for a ball and dislocated his shoulder overhead, came out the bottom, and destroyed all of his labrum completely around his shoulder, as well as tearing his rotator cuff. Normally that would have been a career-ending injury for a quarterback.
Doctors Jeffrey Dugas and Lyle Kane work alongside the 72-year-old.
Dr. Andrews may be the most well-known doctor in the history of what we do, and he's had an incredible clientele. Roger Clemens and Andy Pettit.
In football, for instance, Adrian Peterson, Matthew Stafford, Sam Bradford.
Emmitt Smith, Troy Aikman, Michael Irvin with the Cowboys.
All the wrestlers have had surgery at some point or another with Dr. Andrews, including Triple H and Batista.
And there's been so many of them, John Smoltz, Bo Jackson.
Some of the bigger name Brazilians that have single name recognition, you know, the Ronaldos and those kind of people.
He looked at Kobe Bryant, he looked at Michael Jordan. He took care of some of the biggest names in the history of sports.
And they don't get much bigger than Jack Nicklaus. And as far as A-list patients go, the Golden Bear is where the Dr. James Andrews story begins.
He came to see me with a knee, and I remember back in my younger days, I was getting ready to arthroscope his knee, and I had it all set up, and the knee was sitting there, and I looked down at the knee, and I said, my goodness, I'm operating on Jack Nicklaus. Have I got the right knee?
After that surgery, in 1984, Nicklaus went on to clinch a record-breaking 18th major title at the 1986 US Masters, aged 46. Dr. Andrews was now on a path that would lead to him being labelled as the most valuable man in sport. Today, it's commonplace for professional athletes to have the doc's name written into their contracts as the only specialist they will see in the event of serious injury.
I think the reason he's so important to sport is that I think all the coaches, the agents, the players, all feel like they can come to him and get a real honest opinion.
He's amazing at making decisions to help people. And I can remember at times in my career thinking, I'm not sure he got that one right. And I don't think he's ever been wrong. It seems that he always makes great decisions for patients.
A pioneer of arthroscopy in the 1970s, Dr. Andrews' career has seen him at the forefront of numerous advances in medicine. But he's especially renowned for mastering one of the most complex procedures a sportsman is likely to encounter. Transworld Sport was invited into the operating room at the Andrews Sports Medicine and Orthopaedic Center in Birmingham, Alabama, where we filmed a Tommy John operation in progress.
He became known as an elbow specialist when most people wanted to shy away from the elbow. So the elbow is a tough joint. It's not a common joint that people like to deal with. It's a very complex joint, and especially in an overhead athlete, it can be very challenging to treat patients with elbow pathology.
The Tommy John procedure takes its name from a New York Yankees pitcher who posted career-high figures after undergoing the pioneering surgery 3 decades ago. Andrews and his colleagues perform hundreds of these intricate surgeries every year with a 90% success rate.
It's a ligament on the inside of the elbow here, and as you throw, this ligament takes the stress on the inside of the elbow with throwing. So it's the tissue that takes up the most stress with the throwing motion at the elbow.
The surgeon uses a tendon from the knee to replace the elbow's ulnar collateral ligament.
We've cut into the old ligament here, which is torn, so we're going to attach the graft right down here.
It's a challenging operation, and sporting careers depend on its successful execution. Dr. Andrews and his staff may have perfected it, but every elbow is different, and each case brings its own pressures.
Preparation is 99% of execution. So that's what challenges mean to me. Of course, I accept challenges. I love them. But don't think that I'm not taken back by them, and I'm not worried about them, and I don't think about them all the time.
Along with his practice in Alabama, the doctor's main base is the Andrews Institute for Orthopaedics and Sports Medicine in Gulf Breeze, Florida, on the Sunshine State's panhandle. The warm climes and sandy beaches provide an ideal setting for patients to recuperate after their operations. When Transworld Sport was in town, one athlete receiving treatment here at the Institute was NFL running back Tim Hightower.
The thing that I really appreciate about Dr. Andrews is he's very hands-on. You know, he's not a doctor where he's going to perform a surgery. Next thing you know, you won't hear from him again. He's going to call you, he's going to check on you, he's going to come see you, he's going to, make sure you have everything you need.
Dr. Andrews serves as the team doctor for 3 American football teams, the Washington Redskins in the NFL, and leading college teams Alabama and Auburn. With demanding clinic schedules in 2 different states, a typical weekend will see Andrews charter a private jet to fulfill his numerous commitments. He's a man in constant demand.
Humility is probably the first step to greatness. And if you don't have humility, you're not going to get very far in any profession. My wife Janelle tells me all the time, if you're still talking about what you did yesterday, you're not doing much today. And that's sort of what I live by. So I continually strive to be better. I'm never satisfied. I have a burning desire to be better and never give up with anybody in the treatment of any athlete. And that's really my major motivation.
Over the years, Dr. Andrews has been at the cutting edge of new surgical technologies and rehab techniques which have enabled athletes to have longer careers and recover from injuries quicker. The doctor has also established a sports trauma and overuse prevention program called STOP, which aims to eliminate injuries in young athletes caused by playing too much. The Andrews Biometric Research Center here in Florida looks into Little League baseball injuries and how they can be prevented.
Dr. Andrews set up this lab and hired me to try to understand the mechanics, the biomechanics of throwing, and try to understand why shoulder injuries happen, why elbow injuries happen, how we can prevent them, and how we can improve the treatment of them. And he said, Glenn, I want you to put me out of business. I want you to figure out there are too many baseball pitching injuries and too many injuries that are from repetition, and we need to understand how these people get hurt and try to prevent them.
This institute is many things: a surgical clinic, a medical research facility, a biomechanics lab, an education clearinghouse, and a rehabilitation center for elite athletes. Specific data is collected at the research center by Dr. Glenn Fleissig and his team.
So we put the reflective markers on all the joints of the body. And then once we do that, we have the pitch. And we track the reflective markers with the 8 high-speed motion capture cameras that are fed into this computer. And the software in this computer can collect and show what the person looks like in 3 dimensions from any angle. And then from this view, we're 3-dimensional people in a 3-dimensional world, so we need the 3-dimensional data.
Andrews' 140,000 square foot complex in Gulf Breeze was built in 2007 at a cost of over $50 million. The Institute even has its own mobile units which are taken to football games across the country every weekend. Close to the Institute is Dr. Andrews' waterside home.
And where I'm taking you now is out on the beach out here, on the Pensacola Beach, which is actually an island with beautiful sandy beaches, and my home's right out here on the waterway.
Born in Louisiana, James Andrews was inspired to pursue a career in medicine by his grandfather, who had always aspired to be a doctor himself. Earning a sports scholarship to the Louisiana State School of Medicine in 1959, Andrews was a Southeastern Conference indoor and outdoor pole vault champion. Today, the multimillionaire's hobbies are a little more sedate.
And my pride and joy is this wooden boat on the right. We use it for sunset cruises and moseying around. There we go, abracadabra.
Abracadabra was also the name Dr. Andrews gave to his America's Cup team entry in 2000. Like so much else in the Cajun's life, sailing is something that he doesn't do by halves. The main backer for Aloha Racing, a US entry into the 2000 America's Cup, Andrews oversaw the construction of 2 boats, both bearing the Abracadabra name. While the team didn't challenge for honours, it's a source of pride to Andrews that both vessels remain in the ocean today.
Somebody asked me why did I move down here. I said I wanted to get as close to the water as I possibly could. And as you can see, that's what we've done.
A quadruple bypass operation following a major heart attack in 2006 has done little to slow Andrews down. It's said that every coach in the major leagues has the doc's cell phone number, and he takes calls at all hours of the day, something that his long-suffering wife has had to learn to get used to over the years.
I must say, early on in my career, I may not have had my priorities straight. My family is very important to me. My wife is very important to me. It's a journey for both of us. And I remember one year I counted up the number of games that my wife attended with me, and I was on the field and she was in the stands. And that number that she went to was 55 football games in one year. So there's devotion for you.
Andrews' favourite sport is American football. He has national championship winning rings for his work with both Alabama and Auburn, teams who are fierce college rivals. The Doc is possibly the only man in Alabama who is loved by both state teams, and when it comes to watching the NFL, he sits firmly on the fence.
You know, I love to turn the TV on and see who's playing that I've operated on. Last night, for example, I was watching the New Orleans Saints playing against Peyton Manning with the Denver Broncos. Both quarterbacks were patients of mine. So when one was throwing the football, I was pulling for him. When the other one was throwing the football, I was pulling for him.
And such a list of allegiances in American sport looks set to keep on growing.
He's still got it. He's still got it as good as I've ever seen him have it. I remember 13 years ago thinking he was amazing, and he's still just as amazing now, so he's still got it.
James Andrews has reportedly performed over 40,000 surgeries and shows no signs of slowing down.
Too many to count and not enough to quit. This is our Athletic Performance Institute, and this is where we do performance training. I think as long as I have good health and I have the energy that I have now, it's hard to plan any type of retirement. By the way, if you start thinking about retirement, you're probably already retired. The only time I feel old is when I look in the mirror. So what do? I quit looking in the mirror.
Subscribe now to our YouTube channel for the very best of Trans World Sports.